Do you have a good relationship with your doctor? I'm Catherine with Inspired Vitality, and today I'm going to talk to you about relationships with doctors and share what it was like to meet my oncologist and surgeon after being diagnosed with breast cancer. In my previous video, Lessons Learned Leading Up to a Breast Cancer Diagnosis, I talked about the events and testing that brought me to being diagnosed, as well as some lessons learned from it. If you haven't watched that video, you should do that and then come back to this one. To recap, however, I had had a biopsy and a nurse called to tell me that I had cancer in my breast and lymph nodes. The following day, I went for an MRI, just as part of the information gathering process. Then on Monday, March 9th, I met my oncologist, who I'm going to call Dr. G. During my visit, there were moments when Dr. G held my hand. He was very compassionate. He also examined me, and when he did so, he started with my unaffected side. Now, at that moment, I became annoyed, thinking that maybe he hadn't thoroughly read my chart and knew where my cancer was. So I simply said to him, it's the other side. He says to me, I know, today you get a twofer. It was in that moment that I knew this doctor was for me, a little bit sassy and a lot caring. I left the appointment having received much information, but also with some uncertainty. I had been diagnosed with invasive ductal carcinoma, which is breast cancer that begins in the milk ducts. It's the most common form of breast cancer. It had also metastasized or spread to my lymph nodes. Because of the size of the lump in my breast, which was fairly large, and then the fact that it was also in my lymph nodes, it was considered stage 3 cancer. Dr. G recommended a mastectomy and chemo and possibly radiation. He did leave it up to me as to whether I wanted a single or double mastectomy, but he wanted me to have surgery as soon as possible. So one key takeaway for you today is to always make sure that you are comfortable with your medical team, and if you are not, explore your options. I understand that some people may have limitations with their network or whatever is available to them. However, doctors want to have a good working relationship with you. They want to be able to communicate effectively with you. So that relationship with doctors and the patients is key, especially with a ongoing medical condition or a very critical condition. Make sure that you're comfortable with your medical team, and if you're not, explore your options. Now, Dr. G recommended that I also have a PET scan. Although I had had the MRI, he wanted me to also have this PET scan, which involves an injection of radioactive solution, and I had that on Thursday, March 12th. Thankfully, the results were negative, which showed that I had no other cancer in my body. Next up was the surgeon. By the time I met with the surgeon on the 13th, I had already decided that I would have a double mastectomy, and the surgeon agreed that that was the best course of action for my particular cancer, and the surgery was scheduled for less than 2 weeks later. Another takeaway for you today is that there is much involved in whether a mastectomy versus lumpectomy is recommended for a breast cancer patient. Some of the things to be considered are the type of cancer, there's more than one type of breast cancer, the location, the size, and the age of the patient, whether or not they're of childbearing years. All of these things can come into play for the patient and the doctor, and considering whether or not they're doing reconstruction, and all these options are coming into play for whether or not there's a lumpectomy recommended or a mastectomy, and whether or not a single or double mastectomy is considered. So really, I want you to understand that there's no one course of action for a breast cancer patient. So in conclusion, I've shared with you that it's important to have a really good working relationship with your doctor, and that there's much involved in a breast cancer patient's decision for treatment. If you can relate to my experience or have found the information helpful, please subscribe to my YouTube channel and click on the bell so that you'll be notified of new videos. Then check out my website, inspiredvitality.life. I'm going to end with a quote today by Tanya Massey, and that is, "Cancer is way too serious to be taken seriously all the time." See you in the next video.